talking about the Omicron variant and the surge in COVID-19 cases. We haven't yet reached the peak we got during the Delta surge when more than 2,600 daily cases were reported at its worst. But the numbers are climbing. Yesterday, the Oregon Health Authority reported more than 1,300 new cases. It's a lot to deal with, especially ahead of Christmas, and many people have had to change their plans. Alma McCarty walks us through the very latest.
As 2021 winds down, healthcare leaders once again encourage everyone to do their part at this point in the pandemic. That means vaccinations, booster shots, masks, and other fundamental COVID precautions ahead of a surge.
We've got a very sweet window of time of around 3 weeks, we think, where we're going to start seeing that surge.
Dr. Keisha Kelly, Chief Nursing Officer for Legacy Health, says hospitals are planning for the worst and hoping for the best with the Omicron variant, predicting an increase in hospitalizations and infection rates.
Severity of the illness is not quite what we saw with the Delta variant, but what we are seeing is that those who have not been vaccinated, of course, and those who are immunocompromised and have other concerns, that's really where we're going to see the difference. And we want to make sure that, we want to keep our staff healthy, we want our communities to be healthy. And, and absolutely, we want to make sure that we have beds that are available for those patients who really need it.
Meantime, a new survey from the University of Oregon shows an increasing number of Oregonians are choosing to get the vaccine. Yet a significant number dismiss the risks of COVID-19, which could hinder the progress of combating the pandemic over the last year.
The threat from Omicron is very, very evident. And while Oregon hasn't experienced the same effects of it yet, we very much expect that to happen very soon.
Researcher Benjamin Clark, a professor at the School of Planning, Public Policy and Management, analyzed this data.
Seeing a lot of the same patterns we've seen for the last year in terms of why people are getting vaccinated or not. What we're trying to do is understand how to change people's minds or enable friends and families and doctors and public health officials around the state to find ways that they can nudge those people in the right direction.
The survey also shows the emergence of the Delta variant led to a sharp increase in vaccinations this fall, though the divide between vaccination rates in urban and rural areas continues to be the biggest challenge in protecting all Oregonians from COVID-19. Alma McCarty, KGW News.